Welcome to this episode of the Harpreet Singh Show. In today's segment, we'll talk to Dr. David Spears. He is the CEO of Pacific Health Oral Society. What is the purpose of creating this society and how the public is going to benefit from it? We'll talk to Dr. Spears about this. Welcome to the program, sir.
Thank you.
Thank you. A little bit about yourself, since how long you have been involved with the dentistry field.
I've been a dentist in 1968.
Wow.
I graduated in Britain. I came to Canada after a couple of years because I wanted to see what the rest of the world was about, and of course I met Vancouver and I decided to stay. So I've really spent my whole professional career in Canada.
Okay. What's your association with UBC?
When I first came to Vancouver, I got a very low level instructor job at the university. It was a way to get into the profession. I then did my examinations to do private practice, and for a long time I did both private practice plus some instructing at UBC. More recently, I have been concentrating full-time practice. I tried to retire. It didn't work very well until my friend and associate, Dr. Harry Danju, said, "We're starting this wonderful facility out in Surrey. I want you to help us get involved." So I sort of pulled myself out of retirement, and now I'm working very excitedly with the Pacific Oral Health Society.
Right. What is this society basically? Because there are so many dentists working. Why was there a need to start this kind of organization?
Well, we really have three main reasons for existence. The first is to help people who have some financial challenge with paying for dentistry, which many people have these days. And there is quite a need for people who need to get their dental health done and have a real challenge trying to afford that. So the first thing we are trying to help is people who have some financial challenge to pay for dental treatment traditionally.
Right.
The second thing is that there is always a need for ongoing continuing education, both for dentists and dental hygienists and dental auxiliaries. And so that's the second part of what we're trying to do.
Right.
The third thing is that because this whole concept was seen by the University of British Columbia as being a rather interesting way to have their students see the real world, the other main part of our reason for existence is to act as an outreach clinic for the fourth year dental students.
Right.
So these are people in their final year, and they will get real experience working on real people with real problems in a real clinic that's not in the protected ivory towers of the university. It's doing
Right.
real work for real people, and the students will get a real life experience by being with us.
Right.
And they will spend up to 6 or 8 days in their final year with us on a rotating basis.
So basically, your association with UBC is that students from there will be coming to this particular organization, and over there they'll be working and they'll be getting a hands-on experience.
Absolutely. And whilst there, they will be supervised by instructors just as they would be at a UBC. So any patient coming for treatment will have very carefully delivered dental care under the overall supervision of a qualified dentist.
Right. And as you said, the first motive of starting this organization is to help those people who cannot afford good caring for their teeth.
Correct.
Because it's really becoming quite expensive. So if you could let us know a little bit in details about how does the system work when somebody comes to Pacific Oral Health Care, like on what criteria are they given that benefit?
Well, there are several groups that we are able to help. Anybody who has Ministry of Social Services support already will be able to get the dental treatment, which is paid for already by the government for them. And there is a limit which is fairly modest, but at least it gets them on the way. The second thing is if people are able to demonstrate that they have a limited income, we're able to give them a discounted fee of approximately 30% less than they may expect to pay in a private practice. And interestingly enough, just recently we were just working with the Correctional Services Department that will help people who have been out of their term in jail.
Okay.
And again, these people get some financial support. So we'll be able to help many aspects of the community. So those are the ways in which we can really help people.
Right. What about the infrastructure which has been brought over there? What kind of technology is being used?
Well, we are lucky that the board of directors has been able to put together a first-class facility. It's a brand new facility. The equipment is state-of-the-art, and a lot of financial backing has been put into this facility. And of course, we are not a free clinic, we are a not-for-profit, because of course we do have to at least cover our expenses for being in existence. But we are all very conscious that what we're doing has a large social component, and any of the people working there are probably working at a reduced fee as well. So there's a lot of ways in which people are helping, volunteers are helping, so we want to keep our costs down so that we can keep delivering services to people that need it.
You talked about the hands-on experience which the youngsters, the students in the fourth year are going to get in
Yes.
this particular facility. If you could let us know a little bit about this, that why do you think in the university level, otherwise do the students just get that theoretical knowledge only, they don't get that experience to come out and use their knowledge?
Well, of course, it's always a bit of a grey area. It's no black and white. At the university, of course, they do have to complete the dental work that the patient is coming for, but the primary thing there is they learn how to do a procedure. I think the difference is with us, they'll learn how to apply that knowledge into a real situation,
Right.
because there is a patient waiting to come who also has a toothache or needs a cavity. And so there is some, I wouldn't say urgency, but there's a need to get this job done and move on to the next. The delivery of care is the
Right.
main issue, not learning the procedure.
So delivery of care, as you said, many times what happens is what we listen from the South Asians, especially the Indians or Pakistanis who go back home
Yes.
because it's cheaper to get their dental work done in India or Pakistan as compared to this place.
Yes.
But when they come back, many times they face lots of problems.
Yes.
Now, do you feel that your organization will be a kind of a substitute for them, whereby, as you said, it's going to be cheaper than the normal practice where they go? So how do you feel, and what would be your message to those kind of people who think that it's very expensive to get their dental work done over here?
Well, there are a lot of very fine dentists I know in the Far East and in India. I know personally some very excellent dentists. What I don't know is what the fee structure is. I don't know what their sort of typical standard of care is.
Right.
I came from England, and at one time England was the laughing stock of North American dentists. They said the dentistry is terrible.
Right.
In fact, it's available. So it's probably available in Asia as much as it's here. What we do know is that we can give them a really good service here, and we just take it one step at a time,
Right.
At a reduced fee compared to the average dentist here.
Right. So, Dr. Space, what are your future plans?
Well, we have only been in existence for 4 or 5 months, and we're doing very well. We have patients coming in. We want to grow our base of patients who come to us, not just, by the way, in people who have financial hardship, but we do offer a full range of oral services. So for people that are able to afford a full fee, we'll certainly take those people too and give the full range of dentistry to everybody that chooses to come through our doors. Our growth is going to involve more continuing education. Our growth will also have us bring on more dental students on board. And in the further off distance, we have some ideas of some anesthetic facilities. Very often the work that has to be done, particularly for children,
Right.
can be challenging, and if we have the ability to help people with anesthesia and sedation, then it makes it very much easier for children to get their dental work completed.
Right. And presently, what kind of services are being provided to the patients?
We are serving all basic services right now, including examination, x-rays, cleaning, fillings, of course, extraction work, denture work, and gum work. Those are the primary things. And root canal work. Everyone loves a root canal, right?
Right. Okay. And also, is there a geographical limit which you are catering to, or anyone from
No.
BC can come and get their teeth checked from your organization?
You can come from the Rocky Mountains as far as we're concerned.
Okay. It was a pleasure having you. Thank you, and best wishes.
Thank you very much.
Thank you.